this morning, as we'll be listening to two of our own very own, I call them a power couple. They are not just a power couple, from the world standpoint, but they are also a power couple in Christ. And that is more important than anything else. So this morning is also our Thanksgiving because it's the very first Sunday of the month. So we should be ready after our talk to dance, to give praises to God. And I pray the Almighty God, the heavens shall be open to hear our praises. I bring you greetings from Pastor and Pastor Mrs. as they are unavoidably absent. They are praying for us, and I believe they are watching right now, and they are saying, God bless you. So greetings from Pastor and Mrs. I pray the Almighty God will continue to empower them. God will continue to bless them. The ministry God has put in their hands, the Almighty God will continue to give them the grace, the enablement, the strength to continue to take it higher and higher in Jesus' mighty name. So before I welcome Dr. Olusoya Rufai and Dr. Adedayo Rufai to come up, I'm just going to give us a brief introduction about these power couples in Christ. Dr. Olusoya Rufai is an accomplished American board-certified internist and hospitalist at New York Presbyterian Brooklyn Methodist Hospital, renowned for his dedication for exceptional patient care. His journey in medicine began at the University of Ife, earning his bachelor's in health sciences and master's CHB degree. I believe that's master's in chemistry or medical. Okay. Thank you for the correction. After the internships and further training in Nigeria, he pursued pathology expertise with postgraduate studies in morbid anatomy. Dr. Rufai's pursuit of excellence led him to achieve fellowships in pathology before relocating to the United Kingdom and later to the United States in 1995. He completed his internal medicine residency at Brooklyn Jewish Hospital, where he served as chief resident for 2 years, showcasing his leadership and commitment. As an attending physician and hospitalist, Dr. Rufai applies his expertise to deliver outstanding patient care. Beyond medicine, he cherishes family life with his wife and children, nurtures his passion for travel, and engages in medical missions to undeserved communities globally. His advocacy for healthcare equity is evident through his dedicated service to the Black community in Brooklyn. Dr. Rufai's professional achievements and personal values embody his commitment to excellence and compassion. Through his ongoing contributions to medicine and community service, he continues to positively impact the lives of his patients and beyond. Let's give it up for Dr. Olusoya Rufai. And now I'm going to go into the bio for Dr. Adedayo Rufai, PharmD. Dr. Adedayo Rufai is a clinical pharmacist at NYC Health Hospitals with a specialty in HIV/AIDS and infectious diseases. She obtained her Bachelor of Pharmacy from Obafemi Awolowo University, Ile-Ife, Nigeria, and her PharmD from St. John's University, Queens, New York. She also completed a 1-year pharmacy residency at Brookdale Hospital, Brooklyn, New York. Dr. Adedayo Rufai is a board certified in pharmacotherapy and is also credentialed by the American Academy of HIV Medicine. Dr. Rufai has worked as a pharmacist in Nigeria, the United Kingdom, and the United States of America, and she is an advocate for health equity and easy access to healthcare and medicine, and has assisted many patients in achieving their healthcare goals. Dr. Adedayo Rufai is married and is the mother of 2 amazing young adults. In her spare time, she enjoys photography, baking, and gardening. Praise the Lord. Please join me to welcome Doctors Adedayo and Olusoyan Rufai. Praise the Lord. Let's give Jesus a wonderful applause. Please be seated. So the way we're going to do this, Dr. Olusoyan Rufai is going to give us his presentation. Then Dr. Adedayo Rufai would also give her presentation. The ushers are going to be passing an index card. If you have any questions, please write them on the index cards, and we'll have questions right after they're done with the presentation. Please, the ushers, please pass those, and please let the handwritings be legible as much as possible. And if we have questions online as well from our YouTube audience, please let's take note of that, and we can have those questions answered as well. Praise the Lord. Hallelujah. So, okay.
Okay.
You need the, okay.
Which one? What should I do? Stand. Okay.
So, over to you, sir.
Good morning, church. The slide. So this morning we're going to be just talking about how we can prosper with our health. I've titled this A Healthy Lifestyle. And the first slide that I will be showing you, it shows life expectancy by race and gender. Now, white females, they have a life expectancy of 81 years, followed by black females, 78, followed by white males, 76, followed by black males. This is in the United States. Now, I added Nigerian women. The average life expectancy is 64 years. And then I put Nigerian males. The life expectancy for a Nigerian man is 60 years. Now, you will notice a trend that in all the races and even in Nigeria, the women, they live longer than the men. I always joke with my patients that it is because the women kill us. But the truth about it is that in most clinics, it's just like what we have in the church. The women outnumber the men. So the women always have better health care than women. And I'm going to be talking about some of the things. Now, in my community in Brooklyn, we always, my patients will tell me that blacks don't crack. And I always say the reason why we don't crack is because we die too early. When you live long, you get arthritis. But when you die of a lot of stuff, you know, drugs, gun violence, and all those stuff, we tend to die early. Now, as I put on the other side, the black people in the US are more likely to develop and die from certain diseases than other racial groups. Next slide. Now, I'm going to be talking about some diseases that are very common in black people. One is heart disease, hypertension, and cerebrovascular accident. I put it on there because most of the time, it is usually due to high blood pressure. Some cancers, which I will be talking about: diabetes mellitus, sickle cell disease, asthma, and COPD. That is why I will just talk quickly about sickle cell disease. In a lot of churches now, they want to do genetic counseling so that if you have sickle cell trait, except God tells you, and you are ready to take all the suffering, if you end up having a sickle cell disease patient, that is SS or SC. So I always say it is something that is advisable that for young people, before you go into a relationship, you find out the genotype of your partner. Now, next slide. Now, conditions black people have a higher risk for include, like I said, heart disease. Black people are 30% more likely to die from heart disease than white people. They are more likely to, they have 2 times the chances of developing diabetes, and they have a higher rate of diagnosis from cancer than other races. Now, for breast cancer, black women are more likely to die from breast cancer than other women, and I will talk about some of the reasons why. And when I tell my patients about this, about that blacks have the highest obesity rates than any other group, they say, look, that is not for us because of our strong bone. I don't think that's true. Now, I'm going to talk quickly about screenings and lifestyle changes for detection and prevention of disease. For women, it is advisable to do a pap smear usually it is when you become sexually active, but I always put like from 24 to 65 years. Now, after 65 years, if you have had consistently negative pap smear, you don't really have to do that again. Mammogram, you know, for women, it is advisable that you do a mammogram once you turn 40, and then you do another one every 1 to 2 years. And the reason for this is that you will notice that it is very common among the elite now to be doing, they do mastectomy. They take out the 2 breasts. Because at times, early detection is always better because you can treat early. And there are some particular genes, we call it the BRCA gene, the BRCA gene, that if you have that, you are more predisposed to developing some kinds of cancer. For women, I put more than 50. When you are older than 50 years, you are supposed to do a bone density. But if you are still menstruating, I have patients who are like above 50, and they still see their menstrual period, you can defer. You don't have to do it at that time. Now, colonoscopy. Especially in the black community, we tend to have a higher incidence of cancer of the rectum. The example I make with my patients is the Wakanda guy, Chadwick Boseman. He was in his early 40s when he had colorectal cancer, and that was what killed him. So colonoscopy, as soon as you turn 45, that is the recommendations of the American College of Physicians. See, a lot of people, they don't like to drink that stuff. So when I turned 50, I did the colonoscopy. When I turned 60, you see, medicine is always advancing. You don't really need, except for some very few cases, from very few conditions, you don't really need to do colonoscopy again. You can do a Cologuard. A Cologuard is like 98%, 99% accurate. So I tell my patients, you just do this from the comfort of your bathroom, and you don't have to go and do the colonoscopy, except if your colonoscopy, if your Cologuard, if it is positive. Now, I come to PSA testing. You know, of recent, we must have seen on the news that you have a lot of people that are coming down with cancer of the prostate. Now, early detection is the watchword, especially because our men, we don't really like to go and see the doctor. So, at least once a year, that is what I do, and that is what I tell my patients to do. Get a PSA testing. The number it should be less than 4. Now, at times, you will remember the case of Al Gore, that his own was still actually below 4 when he was diagnosed with cancer of the prostate. But he had like a double, it doubled within a few months. And it turned out to be, you see, once you have the IPSA, you can now decide whether you want to do, the next step, just to see a urologist. Now, since I am speaking to the general population, I put lung cancer for smokers. For people who have been smoking for a long time, they are supposed to do a CAT scan of the chest ever so often. Now, it is advisable for people who are sexually active to do HIV screening. I always like to talk to the young people. I remember in 2001, I had this patient. She was like 20 years old. And she came, she had kidney failure. And she ended up, I used to still work in the HIV clinic part-time. So she ended up coming to my office. And I never forget how she was weeping. And what I tell young people, this is also part of the STD counseling, that, look, abstinence, but if you can't do abstinence, wear condoms. I say condoms keep you alive. Now, I'm going to talk about general stuff like blood pressure. At least once a year, you must have your blood pressure checked. If you have, and you see, the criteria that we use, they keep on changing. There was a time that we used to say, if your blood pressure is below 140/90, that is good. But medicine has advanced. The American College of Cardiologists just came up that your blood pressure must be less than 120/80. Now, if you are between 120/80 and 139/89, that is what we call stage 1 hypertension. That means you need to do some stuff which we will talk about. And if you are above 140/90, that is stage 2 hypertension. The reason why we need to know this is if early detection is always better. Then I put diabetes. Now, diabetes is very, very rampant in our community. So when at least once a year, when you see your doctor, you should do a random blood sugar and also do a hemoglobin A1C. For people who have diabetes, your A1C actually decides how quickly you can develop complications of diabetes if it is not treated on time. I think I have another slide that I will talk about later on. And then your cholesterol. You must know your total cholesterol level. You must know your HDL, which is the good cholesterol. And you must know your LDL, which is the bad cholesterol. The reason why it is so important is the way I describe it to my patients is you have a pipe. When you have cholesterol that is increasing, it reduces the lumen, and that can give rise to coronary artery disease. Now, I want to talk about, next slide. Good. Now, RFK Jr., I'm sure if you are watching the politics, I love watching politics. He was saying that there is a different kind of vaccination designed for black people. That is not true. All vaccinations, they do exactly the same thing for all the races, because he said we are innately immune. That is not true. So I put here the vaccinations that are important. For some of us that work in the hospital, you know, you must get your flu vaccine or you will not be allowed to actually go near patients. Now, for people who are above, I think it's 50 or 60 age, you must get your pneumococcal vaccine. You must get your shingles vaccine. That is to prevent chickenpox. Now, for HPV, it's usually in women, younger women actually, because it tends to prevent them getting cancer of the cervix. And I included COVID vaccine. You know, maybe it's less now, but at that time, there was a doctor friend of mine that never got the COVID vaccine when almost everybody had gotten it. By the time he went to the hospital, this was years after, it was too late. He died from complications of COVID. So nowadays, a lot of us are immune, so I don't really stress that. But I know it is important for people who are like immunocompromised. Next slide. So I put lifestyle changes that we need to do to maintain our health. Now, I put maintain a moderate weight. See, there is something we call a body mass index. That tells you, depending on how tall you are, what your weight should be. So we have, you should be between 20 to 25. And then be above 25 to 30, that is overweight. And then when it is above 30, that is obesity, because obesity is associated with a lot of complications. Say, when I started having pain on my knees, I know it is because I have put on weight. So, and that's what I tell my patients too, that look, if you cut down, okay, and I always make the joke that my son tells me that, Dad, if you stop eating all this Nigerian food, your weight is going to be good. So I say, if you cut down on black people food, you know, what's black people food? The bread, the rice. There is no country I have visited that is not one of the staple food, either bread or rice. Then alcohol. Now, recently, you would have seen on the news that the trend now is to actually avoid alcohol. You see, in the past, we used to say when you take a glass of red wine once in a while, that is good. But now, you have a lot of conditions that actually come from drinking alcohol. And a lot of cancers. in men, cancer of the colon has been associated with an increased risk by drinking alcohol, and in women, breast. Also for the esophagus, and a lot of stuff. The liver too can get damaged and develop cancer if you drink alcohol. Now, I put avoid smoking. Now, this is for the younger people, the young people, because in my office is in Brooklyn, so my patient would tell me, doctor, I don't smoke. I just do weed. And I tell them, weed is as bad, if not worse, because it opens the channel to you going on to higher drugs like crack or heroin. The other one is they tell me, doc, I don't smoke cigarettes. I vape. And I tell them, electronic cigarette is also as bad if you like smoking, and it causes a lot of damage to the lungs too. Now, I think I spoke about this, the food that we eat. You know, we should do more vegetables, you know, than the eba, amala, enyon, and all those stuff. But what I tell my patients too is that, you see, life without some food becomes meaningless. So I said, if you want to eat pounded yam, you can have a little bit and have more vegetables. You know, many years ago when I was doing my house job in Elisha, I had this woman, and I told her I was a young doctor, so I didn't have as much wisdom as I have now. So I told her, Mama, meaning you can, and that's in Elisha. Elisha is known for pounded yam. And the woman started crying that all her life she had been trying to send her kids to school. Now that they are established and they are giving her money, the food that she loves the most, I said she cannot eat. So with it comes wisdom. You reduce the amount. And then I put, do exercise. You know, most of the problems that we have in our community, or maybe in America, is because of our sedentary lifestyle. We have to move. And if you do like 30 minutes, 5 days a week, that actually helps a lot. I know Pastor said next week we are going to be talking about mental health. So I'm not going to talk about that. I'll just put it there that in our community, we tend to have this stigma about seeing the psych, about getting mental health. And I tell them, I said, it's because you are poor. Because when you go to Hollywood, they all have their shrinks that they go to, and they go there on time. So when you have problem, at times the pastor cannot help. At times your significant other cannot help. And at times, you don't even want to talk to your doctor about it. Especially for the young people, we tend to stigmatize them. So what I tell them, I say, look, my friend that we talk every day is a psychiatrist, so I get my counseling from him every day. So if you want to, you should do that too. Then I have sleep. Many of us, we think sleeping is something that can be ignored. In all the studies that have been done, you must get at least 6 to 8 hours of sleep every day. Now, next slide. Just I have to add 2 or 3 more slides. I have this. Let me disclose. These are not the true names, but these are real patients. I have Felicia came to my office. He became my patient in 2008. She was from Grenada. Her father was my patient then too, and he was blind from diabetic retinopathy. He was on dialysis from diabetic nephropathy. Then she was 35 years old. When I saw her blood pressure was crazy. It was 180/100. And her hemoglobin A1C was 14. Now, the normal hemoglobin A1C should be from should not be more than 5.7. If it is above 5.7 to 6.4, that is pre-diabetes. That is, you don't have diabetes, but you are borderline. So when it's above 7, that is between 6.5 and 7, that's just diabetes. When it's above 7, that is uncontrolled diabetes. So when you look at it, when I saw her, she was 14. She still refused to. In fact, my wife and myself, we went to visit. We went to Grenada to see her at one time, but she decided all those herbal medications were just good enough. Then, actually, she died now. But then, she was completely blind. That was sometime last year. She was on dialysis. And then life becomes meaningless. Now, I also have a friend, a doctor this time around, who he called one of our other friends. We went to Brooklyn Jewish together. And he said, Aja, I did this to myself because he never did colonoscopy. He was a doctor. By the time he started having all these symptoms, he already had stage 4 colorectal cancer, so I still come back to my main theme, early detection. It actually helps. The second one that I have is a Nigerian. When I saw him, his blood pressure was crazy. And his blood count was low. So, and the creatinine was 10. Now, the normal creatinine, that's the kidney function, should be like 1.2, nothing more than 1.2. His own was 10. So I admitted him at the hospital, and we started dialysis. He was my friend. Then one day he told me, he said, Dr. Rufai, God gave me new kidneys. The angels dropped them. See, I didn't know he was saying that he had stopped dialysis. About a week after, we found him dead at home. Now, I have it here that, next slide. So I put it here that how often should I see a doctor? And I put some general guidelines. Under 50, I put this, but really what I advocate is to do an annual physical. That is, you will see your doctor, talk about some symptoms that you are having, get your blood pressure checked, get your weight checked, and do your blood work. The blood work will consist of all the stuff that we have spoken about, so that we can actually take care of it before it gets out of hand. Now, people with chronic conditions, if you have high blood pressure, you have diabetes, you have high cholesterol, you need to actually do visits at least every 6 months. That is to see if there is any progression. Now, people with a history of family disease, this group, it is different what you have to do. And I tell my patients everything. I tell them when they say, oh, Dr. Rufai, why is it that you said I should see you every 6 months? And I tell them that, look, your dad had this problem. Your mom died of this problem. So it is better for you to do more frequent visits. And I always tell them my story that my father died February 14, 1968. I was 5 years old. He died from complications of high blood pressure and diabetes. So I said, I make sure I do, apart from checking my blood pressure frequently, I do my blood work every 6 months just to see where my hemoglobin A1C is as at that time. Then I put there for people who are 30 to 40 years, you do annual physical. I am going to stop there, but before I go, I have an acknowledgement. Say, the person who did these slides, or who colored it, she is the one who has colored my life since 1989.
Good morning, everyone. That was really hot and heavy. But you know, it's all good information. And one thing that I always tell people is you have to know your doctor has to know you. Don't be just a co-pay to your doctor. You should have your own personal. There's some places where you go and you see a different doctor every time. That facility doesn't know you. And I would recommend that you find a place where you have one doctor that sees you all the time, that knows you, and that you can call. And then the other thing, when it comes to a pharmacy, you know, we have lots of big chain pharmacies. Those people are busy. They don't know you. You're a number. You're a $sign. They want to fill your prescription. They want to send you out. Try a smaller pharmacy where the pharmacist knows you. That if your medicine's running out and you don't have refills, they can call your doctor for you. So that's just that. So today I'm going to talk about over-the-counter medications. Next slide, please. So, you know, we all run to the doctor, you know, it's all serious, it's all this, it's all that. But we as individuals can take charge of our health as well. We all know that health is wealth. And sometimes there are small little things that if you nip it in the bud, it won't escalate into something bigger that you have to go and see your doctor. So some of these things are, you know, you can treat with over-the-counter medications. So what is an over-the-counter medication? It's one that can be bought without a prescription, which means that you don't have to see your doctor. You can just go into the pharmacy, look at all the drugs on the shelf, and try and figure out which one is right for you. Unlike prescription medication that is prescribed just for you and should not be shared, over-the-counter medicines are generally general meds that can be shared with other members of the household. Next slide. So if you want to take or give an over-the-counter medication, what do you need to know? A, you need to know how to read the label. You know, you go into the store, for cough mixtures, there's like 20 meds. For headache, there's another 20 meds. You need to know how to read the back of that box to know what is in that medication, to know what you're taking. You need to know the right amount of medication. For example, ibuprofen has different strengths. There's 200, 400, 600, 800. You need to know the strength that's right for you. You need to know when to stop taking the medicine. OTC medicines are not meds that you take every day, all the time. It's for a little while just to deal with what you're dealing with right now. And you need to know when you should not be taking these meds. Not all meds are for everyone. If you're allergic to aspirin, maybe a naproxen, ibuprofen is not for you. So always, when you buy a med, if you're not sure, just try and have a talk with the pharmacist. Next slide, please. So when you go into the pharmacy and you pick up your bottle of medication, on the back, they always have what we call drug facts. So when you look at that box, you're looking for two things. You're looking for the drug facts and you're looking for how to take the medication. So the drug facts would tell you the active ingredient. So the active ingredient is what you need. For this example, the active ingredient is chlorpheniramine. And drugs have two names. They have the generic name and they have the brand name. So in this case, chlorpheniramine, it's a long name, but it's just Puritan. So before you go to the store, I would advise that you do a little bit of homework, you know. What are you going to the store for? Are you going for a headache? Are you going for cough? So kind of figure out what you need before you get to the store, so you're not standing there with all these meds and then you can't decide which one you want. It always tells you how to take the medication. Is it 1 tablet, 2 tablets, 3 tablets? Always follow the directions on the box. Next slide, please. So I'm going to talk about just a few common, elements that we can treat with over-the-counter medications. And one of them is aches and pains, your body aches, your headaches, your fevers. So if you have pain, I always like to know, why do you have pain? You need to know the source of the pain. Once you know the source of the pain, then you can know what medicine you're looking for. If you have a headache, in most cases, acetaminophen, Tylenol is the best medicine for the headache. If you have leg pain, if it's in the knees, why do you have leg pain? Is it because we're getting old and it's arthritis? Is it because there's too much weight on the legs? Because if it's something like arthritis or too much weight on the legs, you can take meds, but the problem is not going to go away. Sometimes you have to address the source of the ailment you're going for. If you have fever, especially with children, when do you go to the doctor? If it's just a slight fever for one day, you can kind of treat that with a Tylenol, with an ibuprofen. But if the child has a raging temperature, in that case, I would advise don't self-treat, take that child to the emergency room. Next slide, please. So there's kind of 2 categories of medication. We have what we call the NSAIDs. And examples of our NSAIDs are the ibuprofen and the naproxen. And then we have Tylenol, which is acetaminophen. Ibuprofen and naproxen are kind of the same. Your Aleve and your Advil. Those meds are kind of the same, so you shouldn't take them together. If you're taking the NSAIDs, which is your naproxen, your ibuprofen, you have to make sure that you eat before you take those meds. If you don't, they cause ulcers. So if you're taking these meds a lot and you have a little niggling feeling in your stomach, it might mean that you might be getting an ulcer and you may have to lay off those meds. If you're taking your ibuprofen and your naproxen, make sure you eat before you take those meds. Your stomach has to be lined with food for it to be protected from those medications. If you're taking your acetaminophen, which is your Tylenol, that's usually generally okay. All right. And then when it comes to the 2 different meds, the NSAIDs have side effects, the Tylenol has side effects. So I always tell my daughter when she's, trying to decide which one to take, I tell her the NSAIDs, which is your ibuprofen and your naproxen, will kill your kidney. Take it in limitations. Your Tylenol will kill your liver. Take it in moderation. So there is no such thing as a safe medication. Take everything in moderation. If you have swelling, inflammation in the knees, an ibuprofen, naproxen will be best because it kind of takes down the swelling, takes down the inflammation. And even though I'm a pharmacist, I still believe in natural remedies because I try to avoid meds if I can. There are always alternative things that you can try as well. Like for leg pain, you can try a nutmeg oil. They sell it in the store, it's a small bottle. Rub it on your knees at night, rub it on your ankles, your elbows. Try it for a couple of days. If it works, all well and good. If it doesn't, go to your naproxen. Tart cherry syrup, which you can get from GNC, is also good for arthritic pain. As you get older, those joints get a little bit stiffer. Try the tart cherry syrup. I've always found that to be helpful as well. Next slide, please. So we talked about the side effects of the medication. For your NSAIDs, you have to be very careful with the stomach pain, the kidney damage, and it also increases your blood pressure. For the Tylenol, you have to be careful with your liver. Next slide, please. And we also have what we call topical pain relievers. Those are things that you don't have to take into your mouth. So it kind of protects your liver and your kidney a bit better. These are things that you can put on the area of pain. like Salonpas or Voltaren gel. You just rub it on the area and it acts locally. You avoid the systemic, which is the internal side effects. Lidocaine patches is a numbing, it's kind of numbing. You know, you open the patch, you can put it on your back, you can put it on your shoulder. You can also buy these things over the counter. So the benefits are they act locally and you have less side effects. Next slide, please. So now we're going to talk about cold and cough medication, because this is the cold and cough season. So we know that our signs and symptoms of our cold is you get a cough, you can get a stuffy nose, you can get a runny nose, you can get a headache, and you can get fever. So when you're going to the store and you pick up that bottle of cough and cold medication, you need to know what you're looking for. If you have a cough, then you want an expectorant, you know, something to bring that cough up. So you're looking for guaifenesin as an ingredient in that cough mixture. The brand name is Robitussin. If you have a stuffy nose, if you have sinuses and headache, you want a decongestant. You want something to relieve that pressure, to clear that cold. And for that, you can look for dextromethorphan or Sudafed. If you look on the bottle of the medication, it will have these names listed. If your nose is running, you can get an antihistamine. You can get like a Benadryl. With Benadryl, I would recommend taking it at night because it's going to make you drowsy. Do not drive when you're taking your Benadryl. Other non-drowsy antihistamines are your Zyrtec and your Claritin. If you have a fever, then you're looking for acetaminophen in that bottle as well. So you see some of those things that say Robitussin, cough and cold, maximum, and it has all those ingredients in it. If you have all those symptoms, you can get one with all those ingredients. If you just have a plain niggly cough, just get your Robitussin, which is your guaifenesin. Next slide, please. Now we come to the brand and generic. You know, a lot of people come to the store and say, nope, I want brand, I want brand, I want brand, I want brand. It works better. It's not true. It's a lie. It's just the company trying to get more money from you. So if you look at these two drugs, Mucinex Fast Max, it has dextromethorphan, which is for your stuffiness. It has guaifenesin for the cough, and it has phenylephrine, which is also for the cough and the cold. But if you look at the Walgreens brand, it contains the exact same ingredients. If you want to buy brands, you'll pay almost $20 for this medication. If you buy the generic, which has the exact same thing, you're paying $12.50. I, as Yajabu, would like to put my $7 extra in my pocket. So, you know, when you go to the store, they will have the brand name drug on one side, and right next to it, they will have the generic. You can pick up the two bottles, compare the ingredients, and if they're the same, you can decide which one you want to buy. Next slide, please. Then we have the allergy medicine, especially in summer. You know, even as adults and the kids, you see them with the runny nose, you know, they're itching their ears, they're doing the thing with their throat. Sometimes you don't know what it is, but it's allergies, especially in summer with that nose constantly running, the sneezing. So for that, they have different drugs. You know, you can get pills, you can get eye drops, you can get a nose spray. If it's just a runny nose, you can get the pills, which are your Claritin, your Zyrtec, your Allegra. And you find that with these things, if you use it for a while, they stop working. So I always start with one. So you can start with your Loratadine, which is your Claritin. You can probably use that for a year, and then you find that it doesn't work as well as it used to. In that case, you'll switch to a Zyrtec. You can use that for a year, and you know it may not stop working, but if it does, you can go to Allegra. So you can use any one of those, but if they don't work for you, switch to another one. So let's say you have the allergies, and you have the nose that is constantly running as well. Then you'll go to your Claritin Ds, your Allegra Ds, or your Zyrtec Ds. These are the same as the others, but they've put a decongestant, which is a Sudafed, into those medicines just to dry up the sinuses. If it's just the nose and the nose is really bad, it's just watery, you know, there's different types of snot. There's the clear, watery snot, And then there's the green and yellow gunky snots. If it's just clear, it's allergies. You can use a nose spray, they're very effective. If it's gunky, green, yellow, please see a doctor. If it's your eyes in the summer, you know the pollen's out, the sun's out, the flowers are beautiful, the trees are flowering, but your eyes are red and inflamed. If it's both eyes, most likely it's an allergy, and that can be treated with allergy drops. You have your Pataday and you have your Astepro. All of them are quite effective as well. One note with the Sudafed, anything that says D, if you have high blood pressure, it's not the medication for you, because Sudafed or pseudoephedrine raises the blood pressure. So that's just something to take note of. Next slide, please. Sore throat. You know, sometimes we have a cold and we have a sore throat. This can easily be solved by going to the pharmacy. You can get some throat drops. You can get a throat spray, which is usually just a numbing agent. But let's say you're sleeping at night and then your throat hurts. It hurts, it's itchy. Sometimes it's an allergy. It's what we call post-nasal drip. It's just the snot dripping into the throat at night while you sleep. That can be taken care of with an antihistamine. That's your Claritin, your Zyrtec, or your Benadryl. Next slide, please. Now I'm going to talk about our antacid and our acid reducers. You know, sometimes we like spicy food, and sometimes our body just can't tolerate it. So for that, you're going to need an acid reducer. If you have a pain, you know, you feel a burning coming up into your chest area, sometimes that's what we call GERD. It's called acid reflux. It can be brought on by oily food, spicy food, eating late at night. So for those, you can just go to your pharmacy. You can get something like a Tums, which you just chew. You can get some other liquid ones like your Gaviscon, your Maalox. Those are fine, but you just have to use them multiple times a day. You can also try things like your Pepcid. Those you take once or twice a day. Or you can try what we call the PPIs, which are a bit stronger. Those are your Prilosec, Nexium, and Prevacid. Those you take once a day, also very effective. With all these things, they're not things that you should be taking for months. You should be taking them for a short period of time. And even though I'm saying the brand names because it's just easier to pronounce, always look for the generics. They're much cheaper. And one more thing about the proton pump inhibitors. Let's say you get admitted to hospital. Sometimes while you're in hospital, they'll give you one of these antacids just to protect your stomach while you're there. You should not be discharged on those meds unless you have an ulcer or you have the burning that is persistent. So let's say you're admitted and they're sending you home with something like a Pepcid or a Nexium. Always ask your doctor, like, do I still need this since I'm being discharged from hospital? Because sometimes it's not necessary. Next slide, please. Now let's talk about fungal infections. You know, our fungal infections are the athlete's foot. You'll know you have athlete's foot if you take your sock off or your shoes off in public and there's a smell. If you can smell your feet, it's probably a fungal infection. Jock itch is what, you know, the young kids get. You get that from sweat, sometimes in your private areas. The young kids come home with ringworm sometimes, and even adults get ringworm. And sometimes ringworm can be a little bit tricky. You know, it starts off as one little dot and it's itchy. And sometimes you think it's just a rash, so you start putting on a hydrocortisone. But if that little dot starts getting bigger and bigger and bigger, then that's ringworm. And for that, you'll need an antifungal. We all know about ringworm in the head. We used to call it lakpa lakpa when we were younger in Nigeria. So looking at those feet, you see that guy's feet? That's a bad case of athlete's foot. Sometimes if it's that bad, it might have a bacterial component to it. So in that case, an antifungal wouldn't be enough. You would also have to apply an antibacterial. And just a word about those who have diabetes. If there's anything wrong with your feet, go and see the doctor. Because with uncontrolled diabetes, it starts as a little speck, you know, just a little cut that just won't heal. And before you know it, you're admitted in hospital, you have osteomyelitis, you're on antibiotics for 6 weeks if you're lucky. If you're not lucky, they have to cut off the foot. So if anyone has diabetes, if your A1C is constantly above 7, keep checking those feet, make sure there's no infection going on. And just a little thing about, our cuts and our scrapes. I always believe that a stitch in time saves 9. If you get a little cut, on your arm, you're cutting meat, you cut yourself somewhere, take care of it. I'm going to give you a funny story about the pharmacist and the husband in our household. Has anyone seen My Big Fat Greek Wedding, where the guy uses Windex for everything? So in our house, my husband's favorite Windex is Vaseline. So if the kids go to him and say, "Oh, Daddy, I have a little cut," he goes, "Put Vaseline on it." And then they'll look at him and then they'll go, "Mom, we have a little cut on our hand. What should we do?" And I'll say, "Go and get some antiseptic, something like your triple antibiotic ointment, your A&D." I always say, have a big tub of A&D in the house. That thing does wonders. If you get a little boil in the armpit, sometimes we get them in our private areas. It starts off as a little boil. Put a little bit of A&D on that. Within 2 days, you should be good. If not, go see your doctor. Next slide, please. So antifungals that are over the counter, we have I'm not going to go over all of them, but these are all the antifungals that you have. If you have athlete's foot, your feet are stinky, your feet are itchy. After you shower every morning, dry your feet thoroughly and put one of those creams. It could be a spray, a powder, a cream, an ointment, whatever it is. Just put it on the feet daily. It should take care of it. Next slide, please. Okay, now we're going to talk about sleep aids. Dr. Rufai told us how important sleep is. But sometimes in America, we're so busy, we're chasing the dollar, we're worried about work, we did something that we shouldn't have done and we're laying up at night thinking about it. You can get over-the-counter sleep aids. An example would be your Benadryl. So even though Benadryl is an antihistamine, you can use it for your cold, you can use it for your allergies. One of the side effects of Benadryl is sleepiness. So you take a Benadryl 25 at night, you should be able to sleep. Other sleep aids are melatonin, which is more of a natural one. Melatonin is quite good as well because you take it at night and it doesn't linger the next morning. Some of the other sleep aids, you take them at night and you still feel a little bit groggy in the morning. That doesn't happen with melatonin. Cannabis CBD oil has, people say it does help them sleep as well. So that is also an option. But if you have to use these things for a long time, then maybe you need to see a provider to come to the root of why you're not being able to sleep. Next slide, please. Vitamins, my favorite. I like vitamins because, their side effects are not too bad and they do a lot, especially in this day and age when sometimes we don't have time to eat properly. I would recommend a good multivitamin with mineral. It doesn't have to be your Centrum. Remember, I'm a generics girl. Go to the store, get any multivitamin with mineral. Iron. Our females, our young females, you have your periods every month. You're losing blood every month. So sometimes it makes us weak. So maybe an iron pill a day just gives you that little pep. It helps build you back up. So I also recommend those as well. The vitamin B complexes are good for energy. Your vitamin B12. Vitamin C helps your immune system, helps to prevent you from getting colds every so often. Vitamin D and E, good for the skin, good for your hair. So vitamins are good for energy. They give you energy. They help your immune system, help with your hair and skin. They help with wound healing, and they help with colds. And just a little story. I remember when I was young, I used to come to church on Sunday when my kids were younger, and I was constantly tired. It was so bad that anytime the kids saw me, they would go, "Mom, are you tired?" And I would go, "Yes." I was just tired. If I walked up a flight of stairs, I could feel my jugular vein just pulsing. And later I found out it's because I was iron deficient. It was a simple thing that I didn't even know. Once I started taking my iron pills, all the symptoms just disappear. So if you feel something in your body isn't right, try and find out why. Because you know what they say? They say health is wealth. When we feel well, we can enjoy our life better. We can do so much more. Next slide, please. So when should you stop using your over-the-counter medicine? You should stop using the medicine if you have an allergic reaction. You should stop using that medicine if a new problem develops, like you're taking your Motrin, but all of a sudden your stomach is killing you. And if you've taken that medicine for 5 to 7 days and you're not feeling better, then that medicine is not going to work. It's best to go and see your healthcare provider. Next slide, please. So what are the signs of allergy that you should look out for? If you take a medicine and you start itching, you develop a rash, you develop hives, which are just, big bumps all over your skin. If you start swelling anywhere, especially if it's in the throat, the mouth, the nose, that kind of swelling, please see a doctor. If you faint or if you have trouble breathing, those are serious signs of allergies. So if you think you're having an allergic reaction, if it's not too bad, call your healthcare provider. If it is bad, do not hesitate, call the ambulance. Next slide, please. So things to keep in mind when you're taking your over-the-counter medicine. These medicines can interact with other medicines you're taking, with your supplements, food, and drink, okay? May not be right for people with certain conditions. If you have high blood pressure, before you take any medicine, consult with a healthcare provider. They may cause allergies. They might not be safe in pregnancy. When you're giving medication, especially to kids, know what dose you're supposed to be given. If it says 1 teaspoon, it's 5 ml. A tablespoon is 15 ml. Do not get the two confused. Next slide, please. So if you're taking prescription medication before you take an over-the-counter med, discuss with your pharmacist or your healthcare provider. And I think that's about it. Next slide. I think that's it. Oh, and that's it. Thank you.
Awesome. Thank you so much, Dr. Rufai. All right. So we just want to thank you both for the informative presentation. I know it was loaded, and I know each and every one of us got one thing or the other from it. So we pray that the Almighty God will continue to keep you both and continue to bless you. Thank you for all that you do, and we thank you for changing lives, one family at a time. Thank you so much. So I have an online question before we go. We have loaded questions, but we have very limited time for all these questions, so we'll go right into it. So what role does fasting play with regards to health? And
good question. Actually, my wife told me to actually include that. Fasting is, actually, when you go online, you are going to see that, especially for the new generation, they talk about intermittent fasting. You see, fasting actually helps to, apart from reducing the amount of food that you eat, the intermittent fasting is you stop, let us say from 6 p.m., and then you can wait until not 6 p.m. the following day, but maybe till like 1 p.m. The reason is that you actually allow the stomach to rest. Even for people who are admitted in the hospital and they end up having a feeding tube, we don't feed them for 24 hours. We give time for the stomach to rest. So actually, fasting, apart from the biblical concept, it actually is good for the body. And of course, it also reduces the amount of food that we eat.
Thank you so much, sir. You want to? Okay.
And in terms of intermittent fasting, It's said that insulin kind of causes us to gain weight. So anytime you eat, the body secretes insulin. So the more times you eat, the more bursts of insulin you get. So with intermittent fasting, they say the longer the periods of non-eating, which is the longer the periods of insulin not being secreted, helps with weight loss. So that's just my little thing about intermittent fasting.
Awesome. So for those who are not fasting, well, God help you. That's just a joke. Thank you so much. Really appreciate that. What is sleep apnea, and how dangerous is it, and how do you know when you have it?
When you have sleep apnea?
Sleep apnea, yes.
Okay, actually, you see, I love telling jokes. So I had this patient, and she came to me, and she said, "Oh, Dr. Rufai, you didn't work me up for sleep apnea." And I said, "Why do you say that?" He said, "Because I went to see my kid's pediatrician, and they said, 'Oh, you know, tell Dr. Rufai,' she's my friend too, 'tell Dr. Rufai to work you up for sleep apnea.'" And then, of course, I told my wife, and she said, "Oh, did you tell her to lose weight?" Now, the reason why I say that is, for most people who have sleep apnea, one of the most important factors is the weight. So how do you know that you have sleep apnea? Usually, your significant other can tell you, or your kids, because they will say you are snoring. You see, at times, some people have to leave the bedroom and go and sleep in another place because they said, I know we had some people over one time during Thanksgiving, and then my son is a clown like me. He said, "Dad, I can't sleep all night." I said, "What happened?" He said, "That person, she kept on snoring." So one of the is you snore. The other thing that is also important is that when you wake up in the morning, you feel as if you haven't slept. So in our community, actually, sleep apnea is a big problem. That's why, but if you suspect that you have that, you need to do what we call a sleep study. So what the sleep study does is, under a supervised environment, they actually see how often your breathing stops. And that is, they actually quantify it to see what degree of sleep apnea that you have. And usually it is something that, you can do some lifestyle modification, meaning that the weight. You see, once you reduce the weight, it gets better. But for some people, they need to have a machine just to help them to open up the airway, the CPAP machine. Thank you.
Thank you, sir. You know, that's a very wonderful question. So the question I want to ask is, what about if you're slim and you still snore a lot?
Oh, okay. That's also a good question, because I remember, I think our friend is here. Dr. Mrs. Daudu. I see Dr. Daudu. Dr. Mrs. Daudu, when my son was little, she said, I think maybe we went to the house, and then my son snores like a locomotive engine. Then, so she said, Dr. Rufai, you should look into this boy to see, because you see, you know, he's not obese, but at times it may be a problem with the airway. So you will need to see like an ENT just to check if the problem is in the upper airway.
All right. Thank you so much, sir.
Sorry, and if I could.
Oh, okay.
And you know, in this day and age, we have technology on our side. So if you're concerned about sleep apnea, you can get a smartwatch. Find one that can detect it, wear it to bed and it will let you know. So if it's something you're concerned about, get a smartwatch.
Awesome. Thank you. There's a study, this question says a study shows that women who breastfeed, most likely they have breast cancer. So how come we have higher rate of breast cancer? I guess maybe there's a study that shows women should breastfeed more. And now they're saying, how come we do have breast cancer if we're breastfeeding and that's supposed to prevent breast cancer? Or?
See, I am not aware of that study that women, we always advocate for breastfeeding, always, because it is natural and it also helps with bonding with the, say, I always tell the story that I was the last child, so I had so much breast milk that I would tell my mom to sit down, and so I was like 3 or 4 before I was weaned, and that helped to develop my brain. So breastfeeding is good, but I am not aware of any relationship with breastfeeding causing cancer. You see, you have a lot of dangerous stuff out there. They have it that vaccines cause autism. It is not true. So you have a lot of stuff that people just put on the social media and people just run with it.
Thank you so much, sir.
You're welcome.
All right, let me ask this other question. If the white blood cell count is, I guess, 3 and above, what can you do to bring it up? Or what is the consequences of low white blood cells?
That's a very good question, too. Now, the normal white blood cell count is like from 4,000 to about 9,000, thereabout. Now, the condition is leukopenia, that is the white cell count is low. Now, there are some conditions that you have people who are getting treatment for cancer. They are taking cytotoxic drugs. Or you have people who are immunosuppressed, who have like HIV. Their white cell count can be low. But in my experience, if you don't have any medical problem that can compromise your immunity or that can depress the bone marrow, I have found out that in black people, there is something we call idiopathic neutropenia or idiopathic leukopenia, meaning that your white cell count, I have patients like that their white cell counts have always been low. But it doesn't, I just tell them, if you want, you are worried, I will get you to see a hematologist who will get more money and still say, I agree with Dr. Rufai. Just continue to monitor. So if your white cell count is low and you don't have any problem, you don't really need any treatment.
Thank you so much, sir. Really appreciate that insight. I guess Dr. Dayo Rufai will probably be able to chime in on this one. What is your opinion on sleep aids such as ZzzQuil or melatonin?
I feel that sleep is very important. It's extremely important. If you're not sleeping, you need to find out why you're not sleeping. Sleep aids are good for a little while, like let's say for 1 or 2 days you can't sleep, but I don't think they should be used long term. I think you should find out the cause of the sleeplessness. Is it mental health? Is it depression? Is it stress? Sometimes finding the source of the sleep deprivation and addressing the source helps with sleep. Like if you're worried about something but you don't address it, it's not going to go away. So the sleeplessness is not going to go away. But for short-term use, I have no problem with sleep aids.
Awesome. We had it. So this question, this person is and this goes to OTC meds. So this person is asking, how do you know the drug toxicity help me with that word, toxicity. Okay, God bless me. In the medications, how are you able to determine that?
I mean, every drug you buy in the pharmacy comes with warnings. It tells you on the back what the side effects are. But in this day and age, we have AI, we have Google. An informed consumer is a smart consumer. So if you're going to buy a drug, go online and look for the side effects if you really want to know. And make sure you go to a reputable site, not just, those people online coming up with all kinds of things. Go to the FDA website or any reputable, like the Mayo website. Go to a reputable website and look for the side effects. And you can also just ask your pharmacist. He or she will tell you as well.
In addition, you see, I always tell my patients, because at times you give them a medication for high blood pressure. Let's say I gave amlodipine. They want to know, Dr. Rufai, doesn't this have side effects? And I always tell them that there is no medication without side effect. See, I always tell them that if you drink too much water, there is a condition that you will just keep on drinking water. We call it psychogenic polydipsia. You drink so much water, it is going to dilute your blood, and you can actually go into coma. If you take Tylenol, and you take, instead of taking 1 or 2 tablets, if you take 10 tablets once, it can actually make sure you end up in the ICU, because it can damage the liver. So everything in moderation. There is no medication that you take that doesn't have side effects. So you always have to check and see if the symptoms persist, then you have to stop and see your doctor.
Okay, awesome. All right, we're just going to take about just 2 or 3 more questions, and we'll wrap it up. What are the signs, or the signs or the symptoms to look for in stroke and likewise heart attack?
Okay, the symptoms for people who are going to have a heart attack or a stroke, you always have to look at, for instance, you are having chest pain. If you are having chest pain, for some people, it may just be due to dyspepsia. But if you have chest pain and you also have other stuff, if it is on the left side, if it is while you are doing some heavy lifting, heavy work, if you are breaking out in sweats, if you are vomiting, you see, those are symptoms that are very indicative of a coronary artery disease. You must call 911. It's better to be safe than sorry. And the reason is that, especially for stroke, for the two of them, actually, if you have an acute myocardial infarction, or what we call a heart attack, the earlier you get to the hospital, the better, because there is a medication you can be given so quickly, and it will just reverse that. The same thing for if you are having a stroke. If you have a headache that is persistent, if you just have a change in your mental state, you must get to the hospital as quickly as possible. And that's another thing with our people. I think it was last month. Yeah, it was last month. I had this Nigerian patient, and he came to my office, and it was Friday, and he said, "Oh, Dr. Rufai, I'm just having a headache." And he never complained like that before. It was in the afternoon, around 1 o'clock, I was about finishing. I said, "My brother, you know what I would advise you to do? Let me get you to the emergency room." And in truth, he didn't say no. I was walking to the train station when they called me from the emergency room that the guy had a bleed into the brain. So I was so happy that, one, he didn't say, no, Dr. Rufai, it is just headache. I'm going to give Tylenol, and let him go. So you have to pay attention to all those things. But if you are suspicious, it's better to be safe than sorry. My daughter I always tell them, I said, only the paranoid survive. When you are paranoid, and look, you go to the emergency room. If it is nothing, you are good. If it is something, you get treated, and everything gets resolved so quickly.
Wow. Please, let's be very cautious. Our brain is always giving us, our body is always giving us signs, and we need to respond to those signs. How many times do we all have headaches and we just be like, it's okay, it's fine, it's nothing, and it escalates beyond that. So the last question I want to ask, Dr. Dare Rufai talked about herbal medications. There's been a lot of gurus online telling you can use this. How do you decipher which of these herbal treatments or medications are better? How do you know which one and when to use it?
I think with online opinions, because I call them opinions, we just have to be careful. If you feel that what they're saying kind of really doesn't make sense, then it doesn't make sense. But you can go online, and I think there's what we call a pharmacopoeia. There's a list of herbal supplements that do work. And I always tell myself, we're from Nigeria. Before medicine came about, our parents looked after themselves somehow. There are some herbal things that do work, because a lot of the meds came originally from herbal medication. I think we just have to be smart. See who you're listening to, if they're reputable. If what they're saying isn't too dangerous, you can give it a try. Like I know for colds, they say you can boil some lemon, some turmeric, some ginger. In your head, it sounds like, yeah, that would work. Lemon's good for the throat, honey's good. Things like that are safe. But if they're saying put, 2 cups of salt and then put some vinegar and some odd things like that, I would take caution. Just always be aware of what you're listening to, who you're listening to, and, what are they trying to sell you?
Thank you so much. We really want to appreciate your time, to enlighten us this morning. There's a lot of questions that everybody has, and because of our time, we know that time is not always our best friend. But each and every one of us, we can always reach out to our doctors, reach out to Dr. Rufai and Dr. Olusoya Rufai, and just get their numbers so you can ask some of these questions. So just because of our time, I just want us to just just give them a round of applause. Let's just appreciate them. Thank you so much, sir. Thank you, Ma. Thank you.